Yeah, thanks, Joe, and thanks everybody for joining. So what I'll do is I'll talk a little bit uh, in informal terms about some work that Kaustav and I and a couple of others have been doing around the timing and intensity of lockdowns. But even though it's probably not necessary, you probably had more COVID news than you want to. Let me just remind everybody of sort of the scale and magnitude of the disease. It's affected almost the whole world. I did look up and saw there were some lucky islands in the Pacific and other places which have not had recorded cases of COVID. And North Korea, I'm not sure I believe it, but anyhow, for what it's worth, they claim they have no recorded cases of COVID. But otherwise, there have been more than 13 million cases across the world, uh, crossing over most countries. And again, more than half a million recorded deaths. And almost everybody thinks that these are underestimates. And I'm not even counting the number of deaths and other health issues that have happened because people have had problems accessing healthcare or have been afraid to access healthcare because of COVID. So it's really been something of great scale and magnitude. And at the moment, the picture is a little varied across the world. Numbers have plateaued or have fallen in some parts of the world. Hopefully, we now are in a phase where numbers have indeed been falling, as you can see. But it continues to rise in other countries, for example, in India, in the US, Russia, Brazil. So, at the moment, it's still varied, it's still there. And there are, while, there is some agreement about certain things that should be done to contain the disease, we still have wide areas of disagreement. So what kind of policies have people taken for this, and what are the knowledge gaps in this area? So policies have varied from a full-blown lockdown, as you've seen in various parts of Europe and other parts of the world, to encouraging voluntary social distancing, as people have seen in Sweden. Governments across the world have taken what are unprecedented steps, at least in modern times. None of us were, I think, there when there was the Spanish flu in 1918. If you were, I'd be happy to discuss with you what happened at the end of the talk. But so I think most of us haven't been there, haven't seen anything like this in terms of government action, and some of it actually has been across the ideological spectrum. There has been some consensus in terms of the fact that human to human contact seems to be the key to propagation. But there are wide areas of disagreement, some ideological, some about facts, as well as knowledge gaps. For example, we still don't fully know what's the role of asymptomatic spreaders, how prevalent they are. It seems to be more prevalent than initially thought. And how much do they play a role in the spread of diseases, which has led into this discussion of, when to wear masks and so on and so forth. How important are airborne infections? The fact that it theoretically exists is fine, but how important a role does it play in disease propagation? Again, the jury's out there. Will we have second peaks? Or rather, I suppose some people will say, well, yes, we will have second peaks. The question is, how harmful will that be? And are we better prepared for it? Now, some of these knowledge gaps, as you see, requires more data about the propagation or the dynamics of the disease. So a crucial way to fill some of these knowledge gaps is to analyze data about the course of the disease. And then you might have to do that separately across countries, because not all countries will have the same demographics, so will not have the same risk factors. And this is a crucial point. The fact that you need lots of data across various groups to understand the dynamics of the disease is important, but, and this is the tension, if you take up aggressive containment policies like lockdowns, you will actually have less data on natural occurrence of the disease, because a lockdown artificially stops the spread of the disease, which is of course excellent because you need to stop the spread of the disease, and you need to protect lives. But if you're worried about, what will happen if there's a second peak, if you're not quite sure how it affects small groups in the population and so on, by taking very early lockdown steps, you might have taken a decision when you had very coarse data and when you stopped some of the dynamics from which you could have learned more about the disease. Now, even though this has not been discussed too much, there are a minority but influential group of scientists who make exactly this argument. So I won't go into all the details of what everybody has said, but for instance, Professor Suneta Gupta at Oxford believes that the lockdown was actually not justified given the data that the government had at that time. She, co-authors, and others have shown that given the kind of data that you had then, there was huge variation in what the true incidence and dynamics of the disease were. So a lockdown sort of curtailed some of that information, which would have helped us perhaps prepare better. So that's one view which would move you towards pushing lockdown a bit further down. Against that is the fact that if you lock down early, not only do you perhaps save lives earlier, but you might signal to the people, see how serious this is. We are actually taking these unprecedented steps, and therefore make people think about their habits, start, washing their hands more, start practicing social distancing, work from home when you can. And some of these might get embedded in our psyche and continue even after a lockdown is lifted. As you see, not everybody is rushing to the pub, not everybody's gone back to work. People are sort of seeing how they can, still protect themselves better. And that would lead you to actually lock down early because you want the message to come across clear and early and make people start practicing these kind of good habits earlier. So there's therefore a tension, and that's what our paper analyzes. What should be the optimal timing of lockdowns, as well as the intensity of lockdowns? How hard should you go? Because even within lockdowns, there are variations. For example, in the UK, you're allowed to go out to exercise. In certain countries, you weren't even allowed to step outside the door. So our paper, and I'll briefly describe that in a minute, looks at these competing effects of lockdown and tries to understand what the optimal timing and intensity should be, trading off these slightly less discussed facts around information gathering and habit formation, together with the more well-known issues that are discussed, such as the impact on the economy, public backlash against lockdown, and various other things. Okay, so a brief overview of the paper, and I'll mostly keep it non-technical, but given that most of us are either economists or aspiring economists, I will have one slide which is a bit more technical, showing you what the maths is. So this is our paper. This is joint work with Kaustubh Das, who's here with us, and then Kalyan Chatterjee at Penn State and Joydeep Rai at the University of Bath. So basically, the paper formalizes the trade-offs that I just discussed informally. So what we do is, like all models, it's a simplification. So the true test is, do these simplifications give us interesting results or capture the main trade-offs well? We consider 3 periods. So 2 periods in which lockdown may or may not be imposed. So you can think of a lockdown of period 1 as a relatively short lockdown versus lockdown of 2 periods as a relatively long lockdown. So this is our planning horizon. And the 3rd period sort of shows how the world continues, with the payoffs depending on our expectation about various things, including when a vaccine or treatment will arrive. our basic uncertainty parameter is about how harmful the disease is, right? So that is not just the rate of reproduction, but also that weighted with, if it infects you, how likely is it to be harmful? So, yeah, so that's sort of where our uncertainty is. And there are uncertainties about various things. We've modeled this as our crucial uncertainty. Every period, you receive data about the history of the disease and which helps you update your understanding of the likely harmfulness of the disease. So to cut to the chase, given this, what's the benefit of a lockdown? Well, there's a direct benefit. If you lock down, you stop sort of the human-to-human contact, or you lower it considerably. So there's a direct benefit of disease containment. But against that, there's an indirect benefit. It makes people realize something serious is going on. So they listen to messages around, washing your hands while singing happy birthday twice and other things. They start washing hands more than they ever have. And hopefully this kind of embeds in our psyche, and you continue washing hands even after the lockdown is lifted. So this would make you impose a lockdown early, as in fact many scientists have argued. But there is a cost, like anything else, right? So the direct cost is, of course, what we know. There's a contraction to the economy. If you read the BBC headlines today, there's this payroll shrinking of nearly 700,000 in the UK. I mean, if you look at the economic costs across the world, it's huge. Now, of course, there could have been an economic cost even without the lockdown, as we've seen in Sweden, but certainly a lockdown can amplify the impact on the economy. But as we said, that apart from that, we are considering a slightly under-focused area. If you lock down early and hard, then you reduce the information about the disease because you no longer have data points coming through about the natural course of the disease. So now that may be an issue if the disease is novel, because you might have locked down too much without realizing actually how harmful the disease is, or actually you did not pick up until much later, until after the lockdown is lifted. Maybe some of the groups you didn't consider were at risk are actually at risk. Maybe we didn't consider airborne transmission and various other things. Maybe we don't know enough to be able to prepare for the second peak. Now, these are important issues. Tempting as it is to move hard and lock down early, you do need to, especially if it's a novel disease, understand the dynamics a bit better. This second effect, the costs of the lockdown, would make you delay lockdown a bit. Or maybe if you're a late country, maybe you might not do that because you might learn from other countries. But again, every country, as I said, has different age composition. So you might not be able to entirely learn from other countries. And it might not be the case that if you're a late entrant, you would necessarily lock down straight away. You might. That might also explain why some countries have. So this is the basic trade-off. In this trade-off, we consider the motivation of the government as the sole decision maker in deciding the timing and intensity of the lockdown. Now, why that? It's not because we don't think the human interaction isn't important in terms of obeying the lockdown and so on. But first of all, we've seen most people actually have been obeying the lockdown. So if we had real strategic interactions around people not obeying lockdown and rioting and so on, perhaps you could say, well, it's not the most important thing in the world to just consider the government decision. So I think we've actually have a good simplification by saying, what have governments done and why would they perhaps lock down early, lock down late, lock down hard, lock down soft, okay? So that's our main research question. When, if at all, should a government impose a lockdown? For how long and with what intensity? So in other words, short lockdown, long lockdown, no lockdown, really tough lockdown, somewhat less intense lockdown. These are the kind of things that the government can do. So these are the sort of decision variables, okay? Now, what I'm saying here is basically the intuition I've given you earlier, but this is how it is in terms of the parameters of our model. Early lockdown is likely the strength of this habit formation, or you might not want to call it habit formation, you might want to call it the strength of the knowledge hitting parameter that, you know, develop good habits exceeds the benefit of learning from more data by letting the disease progress a bit. This results in early lockdown, which is what many scientists have said. The minority group of scientists and other people who've said, well, perhaps there is some benefit of waiting as well. If you lock down early, as I said, you lose information about the dynamics of the disease. So if the information you would have otherwise received would have been very precise and would have allowed you to learn more about the disease. So for example, some of the early countries which had absolutely no idea what the disease would have looked like, that might explain why they perhaps waited somewhat, because it's worth waiting if by waiting you'd have got more precise information about the disease. So this is the main trade-off that we characterized with these crucial things which act as parameters in the model, which is how high will the cost be to the economy? What is the expected arrival time of the vaccine? What is the expected likely public backlash against lockdown? And some of that depends on, you know, trust in government and things like that. You know, if you trust your government a lot, maybe there'll be less public backlash and so on. So this is our main trade-off, which gives us our main result, which allows us to characterize the optimal timing and intensity of the lockdown with these acting as parameters which influence this decision in turn. Okay, so this is our main result in words. However, as you know, as professional economists, we like tying these things up in neat mathematical equations so that we can make precise and formal statements about it. This is what it looks like mathematically. Basically, this is our main result for any beta positive. So for any habit formation parameter. So anytime, for any world in which once you lock down and give people all this information, some of the good habits continue, right? So for any such world, and P, where P is our information parameter in how accurate our data is, which comes in every period, unless you've locked down, in which case the data becomes less accurate. So these are our two parameters. So given any positive beta, there exists a P star belonging to half and one. So in other words, if P star is obviously half or less, the information is not at all precise. So we don't need to worry about that. We can find ranges of accuracy of information that is between half and P star. So if your data is not super accurate, so lower than some P star, so the accuracy of data every period will be lower than some P star, then you would go in for an early lockdown. So rho 1 star, that is the cutoff probability about your beliefs about the virulence of disease at which you lock down in period 1, that is lockdown early, is actually lower than that at which you would have waited and locked down in the second period. Okay, so this is the P star, in other words, the accuracy of data at which early lockdown would have happened. However, if P star is greater, if P is greater than this P star, so your data is very accurate. So if you had waited a bit more, you'd have got a lot more information about the disease. Then you would have gone in for a later lockdown. In other words, you'd have to be really, really convinced. So rho 1 star would have to be much bigger than rho 2 star. Would have to be bigger than rho 2 star. So you'd really need to be convinced that the disease was going to be extremely virulent. In spite of that, you have no other option but to lock down for you to lock down. Okay, so this is said that you're pushing towards a late lockdown. So that and this is sort of kind of telling you what the optimal welfare is. So if you're interested, very soon we'll post the paper on the website. You can see this tells you the actual welfare from lockdown at rho 1 star. Okay, so this is our main mathematical representation of our main result. You have a main trade-off between knowing more about the disease versus making people serious about the disease early, and letting good habits kick in. That's what it looks like when you write it down mathematically. Yeah. We also like pictures, and even though I've never been very good with graphs, I'll try. There are two graphs. So the first graph says, suppose on the horizontal axis, we plot precision of learning. In other words, how precise the data is every period about the disease. On the vertical axis, which is the threshold at which you'd impose lockdown. Now notice that the threshold in the second period does not depend on the accuracy of the data, because you've already got what data you need in this planning horizons. So that's why it's flat. It depends on the parameters of the model, which if you want to read the paper, you'll see there's an expression for rho 2 star, which depends on these fundamentals of the model. We plotted it for certain parameter values to show this in a graph. So this is flat, right? Because it doesn't depend on data accuracy, which is the last part of the planning horizon. The rho 1 star, which is the cutoff value of beliefs at which you impose lockdown in period 1, begins to increase as the data becomes more precise. So if you expect your data to be more precise, you would wait a bit, learn about the disease, and take whatever costs there are in terms of having spread the disease a bit more. Okay, that's what it looks like. And this is sort of the graphical version of the mathematical statement which we have put up. That's how it looks like. That's the second and the last graph, and then I'll make a couple of concluding remarks, and then open the floor for you to ask questions. The second, and this interest, as you said, if you simplified this to a 3-period model where the last period shows you a continuation of the world given the current uncertainty. So one of the parameters in that model is our expectation about the arrival time of the vaccine, which again gets updated every period in general, not in our model, but this is how, again, data is collected. So on the horizontal axis, we have how long do we think it will take for a vaccine or treatment to come? If we think it's going to take a long, long time for it to come, then we impose lockdowns earlier to make people realize how serious the disease is, and then for them to develop habits and ways of living with the disease, not just hand washing, but how to maintain social distancing, make it part of our everyday social interaction. So we would lock down earlier. So the cutoff beliefs at which you would lock down both in the first and the second period, as you see, is declining. The longer we believe it's going to take to get a vaccine, which again is intuitive, because if you think actually, here's a disease with no possible cure in sight, then we start taking measures which make people believe about the seriousness of the disease, which alters our working habits and so on and so forth earlier rather than later, because there's no end in sight. If instead, when we are locking down, we actually believe that there'll be a vaccine in 2 weeks' time, we probably wouldn't have locked down. Okay, that's sort of it. So just to sum up, COVID has been affecting the whole world, and we obviously think it's not virulent and so on, but there's a lot of open questions about how virulent the disease is across different population groups. How much does it last? What are the dynamics of the disease? How does it spread? Which of course affects, how people get infected by the disease. Lockdowns and other measures which reduce main modes of transmission of the disease have been used by governments for bringing the disease under control. Some of these lockdown measures, especially depending on this timing, has also meant that we are actually not able to predict, even if we can generally for the population, for certain groups, how the disease would have progressed. So lockdown comes with a cost not just to the economy, but with terms of information which might have been valuable for a second peak, which might have valuable for future disease treatment, even for vaccine testing. And what our model has done is provided a simple way to trade these two main effects to help decision makers, governments mainly, to decide on the optimal timing and intensity of diseases or intensity of lockdowns. This can also be used to rationalize some of the decisions that governments across the world have taken and why they have gone in slightly different directions. Because it also depends not just on these trade-offs, but on the other parameters of the uh, model, such as harm to the economy, how much the public would revolt against the government, as you've seen in some countries in the world, and so on, in showing why there is such variation in how governments have responded, even though they have some common goals. Okay, that's it. I'm happy to take questions.